Well, good morning, everybody. Nick Simonson taking over the C103 studios for this Friday special 10 a.m. community program. As always, on most Fridays, we are talking with folks from the Adams County Regional Medical Center, and I have got a nice big old group to talk to today about a lot of different stuff. We're going to start with Rachel. How you doing today, Rachel?
I'm doing well, thank you.
It's good to have you back talking to us about things going on with the Adams County Regional Medical Center. And what do we want to start with talking about today? I feel like vaccinations are in everybody's mind, and that's one thing you definitely want to bring up, right?
Absolutely. That's something that we have lived a lot over the last few weeks, and we're very proud of our community for participating in the vaccination clinics and all of our staff because, you know, every time that we do one of these clinics, we do it in the parking lot. And the last few weeks have kind of been a little cold, sometimes a little wet and very, very windy. So they've put a lot of effort into making sure that we are protecting our community and getting them the vaccine as they need it.
So let's talk about the vaccination clinics for really fast, because you mentioned they're in the parking lot. Matter of fact, you're doing one right now. Can you talk about how the process somebody goes through when they get notified it's time for their vaccination? What do they do, and how do you guys get that to them?
Well, first of all, I just want to make sure that everybody understands the process from the very beginning. So if they want to receive the vaccination, they can give us a call on our vaccination registration wait line, and that's 937-386-3015. They would call in. Sometimes they're going to get a live person. Sometimes they're going to get a voicemail because over the last 2 days, I think we've gotten 175 people calling in to be put on the list. So it's a lot of talking on the phone, and so sometimes people go directly to voicemail, but that's okay. Leave your information. We'll get you on the wait list. And then what happens is, according to the ODH distribution guidelines, they'll tell us what age groups and what group of people can get their vaccination. So as long as we have an allocation of vaccinations, then we start going through our list and contacting the appropriate people and letting them know that they have a vaccine available. So when we contact them and give them a date and a time to come in to get it, then that means that they're guaranteed to get their vaccination. So they don't have to get here ahead of time. They can come at their appointment time, and they know that they're going to be guaranteed to get their vaccine. Now, when they call in to be put on the wait line, the lady who's taking care of that, she can't tell them what day or time that they're going to be eligible to get it, because it really depends on when we get the vaccinations in and how we can put together that clinic. So, you know, she's just taking in the information. But once we call you and give you a date and time, then you know that you can come and get your vaccination. So the day of the vaccination clinic, they'll arrive to our front parking lot, and there's a couple different tents set up, but as they pull into the front tent, they will stop and let them know what their name is. We'll make sure that they're on our list so that we know that the people that we've guaranteed a vaccine are eligible to get that. They will call in to our registration line and give them their demographics and their insurance information. And I just want to make sure that everybody understands that their insurance will get billed for the administration fee. However, that should always be covered by their insurance. And self-pay people, also there's a program that we have that will help cover that administration fee. So the cost of this there shouldn't be any cost to the patient to receive the vaccine. Just on a side note, if somebody should get a bill related to a COVID vaccine, to please call in and let our patient financial group know that so that they can work and get that taken care of, because all of that should be free for you. It's just a potentially processing issue if you do get a bill for that. Once you have registered and they give you a specific PIN number that's specific to you, and you fill out your registration forms, then you'll pull around to our vaccination tent where you will everybody will review your documentation to make sure everything's completed and that you don't have any medical issues that we need to be aware of. They'll give you your vaccination, and then you will pull forward and park so that we can monitor you for a period of time. Typically, it's 15 minutes. Sometimes it can be up to 30 minutes, just so we can make sure that everything is going well with you after your vaccination. If it's the first time you've been through our vaccination clinic, we'll give you an appointment to come back at the appropriate time to get your second dose. And if this is your second dose and you're done with your series, then you can be released and don't have to worry about coming back to see us anymore.
That's always a good thing, right? To not have to go back.
Right. But if they do have to choose a healthcare provider, we hope that they remember that we were there for them and they come back to see us again.
So let's talk first about the list. You said that right now you still have a list. Who right now is eligible for getting the vaccine, like as of this moment, where you guys are at, what you guys are setting up the clinic for, age groups, and who?
Right. So ODH each week has given us a different age group. So right now, as of February the 8th, we should be on Ohioans 65 years and older. So as we have our clinics, then anybody who's 65 and older will be able to come in and be on that clinic. So we've already done our 80s, our 75s, and our 70s. So the next one that we do, that's a first clinic, will be the 65 years and older.
Right, and as long as you guys have enough doses, everybody who calls in will be able to get that vaccine as soon as you guys can run those clinics. About how many people get those vaccines in a day when you run those clinics? How quickly are you to be able to get those people in and out?
Well, when we first started, we were doing about 100 a day, and we worked up to about 224 the last time that we had a clinic. So I think going forward, as long as we have enough vaccine, we're going to try and do at least 200 in a day's time. That way, everything keeps moving, and we can take care of as many patients as we possibly can.
That's a lot of patients in a day. And you said you'd only received like 175 calls, so you're able to get through everybody essentially who was on the list.
Well, we've been gathering this list for quite some time.
Okay.
I think our list had over 1,000 people on it the last time I looked at it. We have administered almost 700 vaccines so far, and, we're working through another 100 today. So, we're making good time through all of the list. But like I said, people sometimes think that we've forgotten about them, but we haven't. I assure you that we are working through our list, and we try and contact people. And, we got to get the confirmation that, yes, they can be here so that we can ensure that the vaccine is utilized appropriately, because once we open the vials, they're only good for so long. So we have to make sure that there's people here and willing to take those when we get started.
So is there a list of people who are, say, they've been called and haven't responded and still need to get in and through, or do you just move on to the next patient and forget about those that have not confirmed that they can get that vaccine?
Oh, no. We start back at the top of the list every time. We sort it by age. So, we do our oldest first, and they always get a chance at being one of the first in line when we do this. So we don't forget about anybody. If we called and we didn't get an answer or a confirmation, we keep moving through the list, but we do go back up through there and try and get a hold of those people, the next time we go through. Or if we run out of the age group that we're in and we still have vaccine left, we start back at the top and start calling again. So don't be discouraged. We will continue to call you. If you haven't received the phone call yet, we will get to you as soon as we have enough vaccine for everybody.
Well, it's good to know, because I think you said it before, and it bears repeating, that you guys aren't forgetting anybody who's on the list.
No, we want to make sure that everybody knows that we are here for you, and we will get to you as soon as we possibly can.
How has the staff been dealing with this being sort of a drive-through kind of setting for this? That had to be very different.
It is very different for us, but I tell you, we have a fantastic team here, and they all pitch in and they take their turns going out. Like I said, the weather hasn't been the most perfect. We would prefer it be summertime. I guess we would prefer to be hot than cold. However, we know that this is the best way to make sure that everybody in our community is safe. And it just helps those people. Sometimes it's hard for people to get out of the car and come all the way into the building. And then to be able to do that many patients in a day and keep them all safely socially distanced would be hard if we did it in the building. So outside in the parking lot is the best way. Otherwise, our clinics would be a lot smaller. We wouldn't be able to vaccinate as many people as we do now.
Well, and it's such an amazing adjustment for the staff that are doing it. Is it like by volunteer, or do you have people who are just like, yeah, I absolutely wanted to do that?
I mean, it's all volunteer. We ask them to come out and to assist. Some of them, it's their day that they're supposed to work in their area. In the facility can let them go and let them come out and help us. So no one's forced to come and do it. Everybody is asked who wants to help, and so they've all been volunteering to do it. So like I said, we have a great team, and it's a little bit of everybody. It's not one specific department or one specific job description that's doing it. We have people from all over the building that comes out and to assist with this.
Well, that's amazing. And if I asked you to thank somebody, I know you'd forget somebody, so we're not going to go through the entire list. There is one question I think a lot of people would be concerned with getting an answer to, and that is, how many people have you had maybe coming back or have called in and complained about any side effects from the vaccine? Because I know, like I said, that's a lot of on people's minds right now is, I want to get the vaccine, but I'm worried about any side effects.
I honestly haven't heard any really bad stories, honestly. I think it's more like any other immunization. You might get those body aches and a low-grade fever, but I haven't heard of any outrageous side effects from it so far.
Well, that's the best news that I could have heard so far, so nobody should be afraid to get it, and we should all get it, which helps us open back up and keeps us all safe in the long run, doesn't it?
Yes, it does.
Well, thank you so very much, Rachel. I know we've got plenty of other folks from the Adams County Regional Medical Center who are with us as well to talk to. So we're going to take our first quick break here on our special 10 a.m. community program. Hopefully you'll stick around because we got to talk cardiology next. We're going to talk the heart. And what better time to talk about the heart than around Valentine's Day? That's coming up next here on C103. Welcome back, folks, to more of our special 10 a.m. community program here on C103. Talking to folks from the Adams County Regional Medical Center, and this one's not necessarily directly related to Adams County Regional Medical. She does some stuff there, but you're basically from UC, aren't you, Stephanie?
Yeah, I'm a foreigner, yes, Nick. I'm an alien
that doesn't make you a foreigner. Southern Ohio is Southern Ohio, whether it's the big city or it's out here in the rural community. But Stephanie, UC Cardiology Department. Is that correct?
Yes. So I am out here as part of UC's collaboration with Adams County Regional Medical Center to increase the services that Adams County patients can have in their own backyard, in their own home.
Now, you've been on the show before. I remember distinctly talking to you when we could be actually face-to-face in the studio. And you had just basically started this collaboration. You were working on the programs you could bring to Adams County Regional Medical Center. You were reaching out to patients saying, hey, if you have heart health issues, don't worry about going to city. We will come to you now. What has the response been, and what are some of the programs that are being developed? Let's start with all of that. I know it's a lot.
All of that. It's just a little bit of it, right?
It's a lot, I know.
I have to say that the community and the hospital here, everybody's just been wonderful. I think that the response has been great, at least to us. Everybody's accepted us. I'm seeing our practice grow. I feel like we're coming out here and really making a difference and touching patients and bringing them much needed cardiac care in their own backyards. We have a few programs that we're starting in on, and the most exciting one is that we're going to start trying to increase the number of stress test days that we have out here and the modalities of stress testing. So we're kind of only doing a couple different types of stress tests out here, and in the next few months we're hoping to expand that into stress echoes so that you don't have to go down to Mercy Claremont or to Cincinnati or to Maysville to get that done. And when we bring that out, we'll bring out expanded days. So instead of just Monday, Wednesday, Friday, we'll do Monday through Friday for stress testing.
Has there really been that much of a response to get stress tests for cardiac health?
Yes, it's much needed. Anytime you can offer as many tests as you can in one place that's close to home, it's better. The less travel you have to do to get something done, the more likely you are to do it, and follow up. So no, this is much needed.
So when you talk about stress tests, I feel like being close to home when you're done with something called a stress test Seems like the closer I am to home for that makes me very happy because your body's already been pushed to the limit.
Yeah, well, I'm not going to say we push you to the limit, but we'll push you a little bit hard. Yeah, you're going to get on a treadmill possibly and walk a good bit for us. Some people don't have to walk. Some people get medicine. But, I think just the mental part of, I had to have my heart looked at is enough that makes you want to be able to just go home and kind of relax and to be close by. To think about getting in a car and driving 40 minutes or an hour and a half to get that done, I think is a little daunting, yes.
What are some of the conditions that you can find in a stress test that makes it so important to make sure that you can offer that close to home?
Well, that is an excellent question, Nick. So, the main reason we do this is to see if you have a blockage in your heart. We'll do it a lot of times for people who complain of chest pain or shortness of breath, something that makes us think you might have a blockage in your heart artery. But the information we get from it is great, especially if we can get you on a treadmill and get you to walk, because I can see your response to exercise. I can see your heart rate go up. And then some of the pictures that go along with this tell me how your blood vessels in your heart are responding to that exercise and whether or not it's getting as much blood as is needed. Another reason we might put you on a treadmill and let you walk is, or want to do this type of test, is if your heart rate's kind of slow, and let's just say you've been falling down or passing out, and we're not sure if your heart rate is what's causing that. We'll put you on a treadmill and have you walk and see if your heart rate goes up appropriately. If your heart rate's not going up when you're walking or you're having some type of rhythm problem, well, then that might mean you might need a pacemaker, or we might need to look at things a little bit closer. And then, of course, sometimes you need stress testing to make sure that your heart's strong enough before you go to surgery or have a procedure done. And we can do that for you and put you on a treadmill and see how things go with that.
So most of these stress tests, did they require a recommendation from a doctor? What's the word I'm looking for all of a sudden?
You do have to have an order. You have to come see us. You can't come in and ask for one.
Right. So it's not just like it's best to discuss all these issues with your doctor. Your doctor will decide whether or not doing a stress test would help discover any particular issues.
Correct. And your doctor might say, I'm going to go have you talk to the heart doctor and see what they think. Or sometimes they say, I'm going to schedule this stress test and then have you go see the heart doctor and talk to them. Either way is fine. So
what would be the difference between, you said you're trying to do more modalities of these stress tests. What's the difference then between what you guys have been offering now and this echo stress test for those that don't know?
So what we're offering right now is you get on a treadmill and you walk and we just look at your EKG, or we give you some medicine and that makes your heart think you've exercised and look at your images underneath a nuclear camera.
Like adrenaline or epinephrine or something?
Yeah.
Something similar?
Yeah, something similar. And then sometimes we'll have you walk on a treadmill, but still look at those pictures underneath the nuclear camera. The stress echo allows us to put you on a treadmill and make you walk and get images right away. And we can do that with younger patients because, and it's a little less, I don't want to use the word invasive, but we don't have to give you the radionucleotide medicine to look at your heart muscle. Not that that's bad. It's just, we don't have to give you any medicine. You walk on the treadmill. We look at your heart with ultrasound images.
Oh, well, it does seem less invasive. If I were choosing the options, if to have a radioactive isotope in my body that I know is safe, it's still radioactive. But if you can take an ultrasound machine, I'm totally cool with that.
Yeah, and it's a great stress test modality. It's awesome.
So let's go back to, you say you're currently offering this Monday, Wednesday, Friday. If you eventually do the stress echo, you'll start going Monday through Friday. Let's say somebody comes in, gets one of these stress tests of any modality, and then they see some issues. What can you guys then do to help with these issues? Because it's not just diagnosis, you have treatment.
Correct. And, sometimes that treatment is medicine, depending on what we see. Sometimes that treatment is, we do have to take you down to Cincinnati and do an angiogram. We need to put a catheter in your wrist or your leg and look at your heart arteries with some dye. You might need a stent, you might not. And then come back and see us, and we'll make sure that your medicines are good and that you're feeling better. And if something like that happens, then we're going to refer you to cardiac rehab as well, which we are capable of doing here.
So talk about then what is cardiac rehab? Kind of like a physical rehab for the heart?
It is. So it meets 3 times a week, and you come in and you are monitored and you exercise. We look at your vital signs while you're exercising. And what the studies have shown us is that people who go through this program do better. You have more confidence about getting out and walking and being active, and your blood pressure is better controlled. Your overall outlook is much better after doing cardiac rehab.
Well, and it's basically non-impact like exercise. When you say exercise, you're talking walking, kind of a low, just get the heart pumping kind of exercise.
Yeah, we won't make you do any Jane Fonda videos or anything like that. It's basically just walking on the treadmill, an exercise bike, working an arm machine, those kinds of exercises.
No jazzercising then.
No jazzercise, unfortunately. Maybe in the future.
Oh, well, I would assume, how is it that just, say, walking or being on these smaller, easier exercises, how does that help boost the heart's health? You'd imagine higher rate exercise, higher pumping rhythms would exercise the muscle more. How is it that just low impact stuff can get the heart going again?
Walking is the best exercise you can do, and it's just basically getting up and getting your heart rate elevated, and how you do that doesn't matter. Walking is easy, it's low impact, and the benefits from walking are just as good. It just makes your heart work stronger. It's like any other muscle. The more you use it, the better, the stronger it's going to be. Your heart vessels, actually all the vessels in your body are in better health when you get up and you move and you exercise. 30 to 45 minutes, 5 days a week walking, and you will see great improvement in your health, whether you have heart disease or not.
Well, and so that's an amazing thing, because it's just everybody can do this and help reduce their chances of having to come and see you, run a stress test, and then come to see you for medication.
Yes, exactly. Much easier. In fact, there are some patients that I will allow try diet and exercise like that before we start any kind of medications.
Well, and it's always the better option if you can avoid medication to do, because your body's handling all of those adjustments naturally, and you end up better in the long run because you don't end up having to, stuck on a medication for the rest of your life. Right.
And it's so easy. I mean, it's something that you can control, and your mental health is better when you get up and exercise. It's just getting up and moving and being physically active is just great all around for your body.
Well, hopefully you're not too busy. I mean, obviously you guys want to make sure you're taking care of as many patients as possible. Hopefully you're not too busy with a lot of heart problems around the area. But if you are, folks, if you get out and walk, you might not have to come and see Stephanie.
Yes.
Which, if you do have heart problems, go and see Stephanie.
That's right. We will make you better.
Well, and as you pointed out, it's much better to have these kinds of things closer to home, where you don't have to go to Mercy Health, or you mentioned Maysville, or some of the other areas, or some of the other area hospitals that are much further away. You can get this done at home, or closer to home at least. So it's only 20 minutes to go back home as opposed to an hour.
Right. And your family's here. You know everybody here. It's just, it makes it easier to go through something like this when you know the area and you're not stressing out trying to find your way to the hospital and into the building and you don't know anybody. Here, it's familiar. You know where you're going. And a lot of times you know at least somebody down here.
Well, and I hope you're learning a lot of people down here, Stephanie.
Oh my gosh, I am. Everybody's just been great down here. I can't say enough good things. I love it out here.
That's what I love to hear. Well, Stephanie, if somebody does need to, they've got a consultation, they have a recommendation or an order to come and see you, how do they get that all scheduled out so they can come and see you and get their heart checked at?
Yeah, so my phone number is 937-386-3420. We'll get you in. I'm here 5 days a week. I've got plenty of spaces.
All right. Well, thank you, Stephanie. And since we're talking about the heart, why don't we talk about the rest of the organs as well? I hear somebody is asking for donations. We're going to talk about that in just a little bit. Stay tuned for more of our special 10 a.m. community program here on C103. And welcome back, folks, to more of our special 10 a.m. community program here on C103. And from hearts and Valentine's Day to your liver, your lungs, pretty much anything else that keeps you alive, we're talking with Andy Johnson from, I believe it's Life. Pass It On. Is that exactly the organ donation you're with?
Actually, the name of we're called Organ Procurement Organizations. There's 57 of us across the country, and the one that serves Adams County as well as 7 other counties in Southwest Ohio, 6 in Northern Kentucky, and 2 in Southeast Indiana is called Life Center Organ Donor Network.
All right. So Life Center, you do a lot to get organs from people who have passed on and get those to people to keep them alive, essentially, for much longer. And do you have a lot of organ donors in the area, or is this kind of a dying art?
Well, no, I would say about 61% of the people in our service area, and so those 8 counties in Southwest Ohio, are registered to be organ donors, meaning when they went to the BMV, which is where you're always asked the question, do you want to be an organ and tissue donor? 62% of the people here in our area who were able to, obtain a driver's license or state ID said yes. However, we still need more people to register. This is a critical healthcare crisis in our country, and I realize that COVID has been front and center, as it should be, since early last year. But there are still over 112,000 people in this country who need life-saving organ transplants to survive.
112,000 people on that list right now?
Yes, and locally it's about 600. So 600 men, women, and children in need of life-saving transplants.
That's a lot of people. And if I'm wrong, one single person through the gift of organ donations can save a lot of people on that list.
Yes.
How many people
can save up to 8 lives, potentially, and also help countless others, up to 75 people, through the gift of tissue donation as well as cornea donation. So it's just an important decision. It's a yes that could help save and change someone else's life when you're no longer here. So we really just encourage people to educate themselves about what this decision means. And they can always visit our website at lifepassiton.org and get more information there. It's just, I kind of look at it as if I were in that position in need of a transplant or one of my loved one, I would hope that someone would say, that there's be a yes on the other side of that to help me or help the person I love.
So you happen to mention you can save up or assist up to 75 other people through tissue donation. I definitely want to talk about that. But let's talk about the major organs that everybody, I think, already knows you can save a life with. Heart, lung, liver. What are the other organs that are life-saving organs?
Kidney and pancreas. So those, and then total it would, potentially one organ donor could help up to 8 people if they were able to give all of those gifts.
But now that's 5 organs, 8 people. How does that math work out?
So you can split. That's 2 kidneys. So 2 kidneys. You can also split the liver, and then lungs as well.
Now, one interesting thing about the kidneys and the liver, though, is you can live donate those with very minimal actual health detriments, correct?
You can. And we are seeing a slight increase in people making the decision to be a living donor. Either they know someone who is suffering from kidney disease or doing dialysis because of kidney disease, and they need a transplant. And so people are stepping up to get tested. And so that is a remarkable way to reduce that, as I mentioned earlier, the more than 112,000 people waiting for life-saving transplants.
I happen to know a friend of mine who actually donated her kidney. Ashley, thank you so much. You're an inspiration to us. I've been looking for somebody who might be wanting one of my kidneys because of you. But for anybody who might be considering that, what would be the process, and how does organ donation affect them afterwards? And if you know.
So really, there's no physical impact post-donation. And if a person is able to donate, first of all, there's a thorough medical, psychological evaluation and testing process that occurs. And then also determining, is that person a match for the person that they're wanting to donate to? But no lingering effects. I have a colleague here at Life Center who was a living liver donor to her brother about 5 years ago. And she is doing fantastic. Her brother's doing fantastic. And there's been no impact or adverse reactions as a result. So people go on to live very healthy lives. You can function with one kidney, and for living liver donation, the liver actually regenerates after it's a small portion that is used to help the recipient who needs it, and then it regenerates.
Now, what a cool thing for the liver to do, right?
I know. I think it's amazing. I've been doing this work for over 15 years, and I can tell you I am always just amazed and surprised and just proud of the medical advancements that have been made in this area, because so many people are able to live healthy lives as a result of the gift of organ donation, either through deceased or living. So it's miraculous. It really is.
Well, I think what's more miraculous is when we talk about living donors, you happen to mention some familial donations. That seems to be the largest percentage of living donors is either friends or family members who offer up their organs to people that they know. But is there a rising number of people who are giving just organs for people they don't know? They just wanted to give their organ to somebody and save a life.
That's a great question. You are seeing more of that, and I think a lot of that is due in part because the stories are just everywhere. I think over the last several years we've seen people purchasing billboards trying to get their loved one a kidney, or you'll see signs on corners or what have you. And then through social media, people are saying, hey, my wife needs a kidney. And I think that people are just, that's what's great about, our country and our society. We want to help one another. And so people feel compelled to do something. And so it's, people can reach out to the local transplant centers here, which are the Christ Hospital, as well as University Hospital and then Children's Hospital. All three have living donation programs. And if you aren't a match for someone that there's also what's called a paired kidney exchange program, where if you are able to donate a kidney, then and you're not a match for the person you want to donate to, but you could donate to someone else, and then in turn, the person who was going to donate to that person could donate to your person if they're a match. And so there's been a lot of success with the paired kidney exchange. So I would say if people are interested in getting tested for someone they know or a family member and they're not a match, then please ask the coordinator at the hospital, what about the paired kidney exchange program? Because that's an awesome opportunity to help the person you want to help, but in a different way.
Well, I don't think I've ever heard of that program, and I'm astounded. Yeah. How long has that been going on?
I would say it's been going on at least the last 8 years. And there was a time, I'd say maybe about 3-4 years ago, where there were national news stories about paired kidney exchanges that occurred. And it was like a huge donation chain where 20 or so people would end up getting kidney transplants as a result of the paired kidney exchange program.
Almost like those drive-through where you pay for the person behind you. You're giving up a kidney so that hopefully the friend of yours can get a kidney in the end of it.
That's right. You're paying it forward. I love that analogy. I think that's great.
That was the first thing that came to my head.
Yeah, it was good. That was good. But yeah, so like I said, this transplantation has evolved so much, and just there's doctors, transplant surgeons have, had to become creative in doing programs like the paired kidney exchange in order to help more people live. So kidneys are what are most needed. When I talk about that national waiting list, most of the people are waiting for kidneys. So we know that we can help people through living kidney donation. And I think if someone wants to do something and wants to get tested, then they should. We have a lot of volunteers here at Life Center who are living kidney recipients, and they just felt compelled to donate. They saw something on social media and just went through the process, and as a result, they were able to bless someone else.
Well, and you mentioned that most people are on that waiting list for kidneys, but there are plenty of other people who are waiting for things that you can give away after you are deceased, heart, lungs, and things like that you're not using anymore.
Yeah. Right. And I think that's the other part of this conversation. It's really just, we as a community, we need to get the facts about organ and tissue donation. Sometimes there are myths that, like generations of families will just believe as that they're truth. And they're not true. The one that I hear often is doctors will not do everything they can to save my life. And that's absolutely not true. A doctor's only responsibility and a medical professional's only responsibility is to save that person's life. And it's not until death has been declared and all life-saving measures have been exhausted that donation even becomes a part of the conversation. So I really just want to emphasize this is a great opportunity to educate yourself about this life-saving gift. Visit our website, lifepassiton.org. And just, you're never too old to donate. That's another one that I often hear. Someone maybe in their 60s and they're like, well, I've had this health condition or that, or I smoke, so I couldn't be a donor. And what I say is never remove yourself from that process. All of that is evaluated at the time of your death, but you absolutely could help someone else.
Well, and I would love to hear more about some of these myths, and I want to talk a little bit more about tissue donation. So we've got a little bit more time. Let me take a quick break. We're going to come right back and hopefully convince a few more souls out there to offer up the gift of life through organ and tissue donation. So give us just a minute. We'll come right back. Stay tuned, folks, for more of our 10 a.m. show here on C103. Welcome one last time for more of our special 10 a.m. community program here on C103. Having an interesting conversation with Andy from the I got your title wrong again, Andy.
Life Center.
Life Center. Thank you, from Life Center.
Yeah.
And we wanted to talk a little bit more about some of those myths that you hear about organ donation. You mentioned the biggest one, which is the idea that doctors won't do everything to save your life if they know you're an organ donor so they can get those organs out. But that's not true. You've already dispelled that. What are some of the other myths that you think people believe about organ donation?
People believe that it's against their religion. And all major religions support donation as a final act of giving. And so that's one that we hear quite a bit. I can't have an open casket funeral if I'm an organ donor. Again, you have any type of service that you wish. The recovery process is treated like a surgery. So it's, it's a very respectful process. Once organs and tissues are recovered, there's no evidence that there was, a procedure that was done to do that. So those are the top three that I hear. And then some think that there's a cost to the donor family for their loved one to be a donor. Again, that's not true. There's no cost to the family for their loved one to be a donor. We handle all of those costs, meaning Life Center handles all of those costs for the facilitation of recovery of organs and tissues.
Wow, that's those were some interesting myths, because I'd never thought that there might have been a cost, but and me personally, I think I would wear those suture marks as a badge of honor that I had given my life, or my life was able to be passed on to up to 8 other people.
Yeah, exactly. I think it's deeper in that. I think that, and this, completely understandable, but I think some people, you don't want to think about your own mortality or death and dying. And so I think this is kind of just something like, oh yeah, I couldn't do that because of this myth or whatever. And so, I understand that, but I think it's important, as people are talking about their end of life care and what that would look like, this is an important aspect to that. You have the opportunity to help other people when you're no longer here. And I think what we've learned over this last year and few months or year is we need to come together as a community and help one another. And so this to me is another aspect of that. This, we can help people when we're no longer here. And it's as simple as a yes, saying yes, you will be an organ and tissue donor when you renew your license or state ID.
Well, and you mentioned helping each other, and to help the greatest number of people, we got to talk about tissue donation, because it's not just those life-saving organs. It's the skin or cornea or so many other tissues you can donate that will help improve somebody's life. It might not save their life, but it does improve their life in so many different ways.
Absolutely. And I'm glad that you brought that up, because, again, we hear so much about organ donation. Tissue donation is just so important and can help so many people. People who are battling, may have had a knee, like blew their knee out and need, a torn ACL and need a replacement, back surgery, spinal surgeries, dental surgeries, cornea donation gives people the gift of sight. I mean, and that is amazing. And what a lot of people, again, this is a myth, is some people think, well, I've had cancer, I can't be a donor. Well, people who have died of active cancer are able to be cornea donors. And so what an amazing way to help someone else. But tissue helps, as you mentioned, skin helps burn victims. We have the Shriner here that is the Burn Institute for Children. Much of the tissue or skin that we recover goes to help those burn victims, those children, as they're recovering from their wounds. As well as at UC, we have a burn center. And so it really is endless, the opportunities just to help out other people.
I have to ask, what's one of the more interesting, tissues that you can donate that's kind of surprising to you, in one, that A, you can donate it, and two, hey, this helps somebody in such a great way, you wouldn't believe what donating this would do?
That's a great question. This was interesting to me. So a couple things. For tissue, tissue can be stored for up to 5 years, which most people don't realize. So it's not something that has to be used immediately. But what I found is interesting is people who have implants, like dental implants, like if you have to have a tooth extracted and get an implant, it's actually bone, cadaver bone, that's used for that implant surgery. So I find that to be really interesting. Also, I didn't realize that an Achilles tendon can be used to repair torn ACL, because Achilles is the back of your foot. ACL is, your knee, the joint tendon in your knee, and that can be used to repair a torn ACL, which helps many athletes, get them back out. Cervical, like spine injuries, bone helps to repair people who need cervical fusion surgeries, which is a really delicate surgery. Again, I didn't know that until someone that I knew needed to have that surgery. And then I learned, as well as she learned, that came from a donor. And I was like, that is amazing. You don't realize women recovering from breast cancer, reconstructive surgery, often cadaver tissue is used for that surgery. So it really is, just an endless list of possibilities. And
Wow.
that just, it helps keep people mobile and just able to be a part of life and, be with their families and do the things that they like to do.
Wow. Well, and I have to ask this question because you've mentioned cancer a couple of different times, but mostly in the midst of, hey, if I have cancer, I can't be an organ and tissue donation. But when I hear the word cancer and I think tissue donation, my first thought is bone marrow. Do you guys handle bone marrow as well?
We do not. There's actually another organization that is called Be the Match that handles bone marrow and oversees the bone marrow registry.
Wow. Okay. But so you guys aren't really a part of that. I don't want to ask any questions then about it, but also something for something to think about for anybody who wants to do a living tissue donation. There's one that you could think about. I heard it's a little bit painful, but it's very much worth it for kids who are recovering from leukemia and patients who are recovering from that kind of thing.
Yes. And in fact, a few years ago, there was an employee of the Cincinnati Reds who was battling leukemia, and actually that saved his life. And he and his wife, I believe they have 4 young children, and he's doing so well as a result of a bone marrow transplant.
It's amazing how little you can give and save somebody's life. To me, that's just the most astounding part of organ and tissue donation.
Yes, absolutely. So again, I really just, I think people should just look at all of the information that's available. I believe knowledge is power. And then also just, if donation hasn't impacted you directly, I'm sure guests can think about maybe someone that they know within their faith community or just at work or what have you that has been impacted by donation, either as a recipient receiving a gift or maybe their loved one was able to help someone else. And so those to me are always great opportunities to learn about the impact of organ, eye, and tissue donation when you really can hear and understand those stories and how it helps people.
Well, we're coming to the end of the show. One last thing I want to go through with you, and I know that most people have already made up their mind about whether or not they want to be an organ and tissue donor. If you have, you're an amazing person, and I love you so much. If you haven't, it's your decision. But I want to ask you, Andy, what do you say to somebody who says, no, I absolutely will not be an organ and tissue donor? How do you convince them to change their mind?
Well, here's my thing. I don't ever want to convince anyone to do anything. But what I would say is, again, think about if you were on the other side of that. Think about if it was you or someone you love or your child that needed that life-saving gift. And that gift wasn't available just, because there's not enough organs available. And so I think when you kind of look at it from that lens and that perspective, then you start thinking like, why wouldn't I do this? Why wouldn't I help someone when I would want to be helped if I was in that situation? I can't tell you how many times I've spoken to moms who are up at Ronald McDonald House staying because their son or daughter is waiting for a life-saving heart transplant, and they're just waiting. and that's agonizing. So to me, it's kind of put yourself in that spot, and what would you hope that your fellow man or woman would do? I lead with that. That's, I don't want to convince anyone, but I just think if we start with our heart more often and just kind of feel like we need to do the right thing, I think this is one of those things where it's just the right thing to do.
Well, it's a beautiful thought, and I feel like if more people did that, put themselves in somebody else's shoes, the world would be a much better place, don't you?
I agree. Absolutely. You'd be surprised, people who never thought they'd be in that position. And, we don't know. We don't know what's going to happen from one day to the next, and so you just, I think it's the right thing to do.
Well,
Absolutely.
If somebody wanted to learn more about organ and tissue donation based on our conversation today, I know you mentioned a website, which is
lifepassiton.org, or you can always call our office at 558-5555, and they'll connect you to our department, and we are happy to talk with folks. We're happy to do presentations, virtually or in person. We are happy and always ready to educate. So please feel free to call us.
Well, thank you very much, Andy. And while we're still got just a little bit of time, I want to go back through if you need to get on the list for vaccinations. Rachel, can you get back on here really quickly? If you need to get on that list for vaccinations through Adams County Regional Medical Center, what's the best way to do that, Rachel?
You need to dial 937-386-3015.
But thank you, everybody, for joining us for our special 10 a.m. community program. I want to thank Rachel and Stephanie and Andy all for giving us the information that they can and for all that they do for the community. And I hope you enjoyed this 10 a.m. We're going to turn it back over to the music now here on C103.